Hello there, it is Dr. Fern, and you medicine women are here if you want a life that you absolutely love. So I used to doubt my front desk girls. They would say things to me like, patients are one way with you, but they're different to us, Fern. They're really more demanding, and this patient was like this, and I would think, oh, I don't know about that. When the patients were with me, they were so sickly sweet sometimes, and I was starting to doubt the front desk, thinking, what is going on? Maybe it's your communication. Maybe you don't know what you're saying to bring out the best of this patient. And one time, and this is a while ago, not in my practice, but we were really, really short-staffed. And so I ended up picking up the phone and I pretended to be a staff member. And I'm sure all of us have done that at some stage. I wasn't myself because I was thinking dentists don't pick up the phone. So I pretended to be one of my staff members and I picked up the phone and I said, hello, whatever clinic it wasn't my clinic at the time. This is clinic, X clinic, you're speaking to, and I just picked out a name of one of the girls. And the patient on the other end was an older male patient of mine who I really had a really good rapport with. And he was on the phone with me, and I pretended that I wasn't the nurse, and what I had to do also was go up a few octaves higher so that they wouldn't recognize me. And he said, listen here, now you tell that Dr. Fern that she can't run late next time, and I've been waiting and my time is precious too, and yada yada, and I want to make sure that it never happens again because I don't like that. Anyway, he said something along the lines of that, and I was sitting there really shocked because him and I had always had great conversations, and we were talking philosophy and we had great rapport, dentist to patient. And there he was going on and on and on about what he didn't like about me and the appointments. And I said, absolutely, let's call his name was John, and it won't happen again. And the funny thing was, when I saw him the next day for his appointment, he was sickly nice to me, sickly sweet. No problem. We made sure we didn't run late for him, of course. And I started to think to myself, oh, there is a miscommunication here. There is something going on. The patients maybe do treat the nurses a different way, some of them anyway, and then maybe treat us a different way. And I started to think, that's interesting. And from then on, I always put my staff first and I always listened to them. And this would have happened about maybe 12 years ago. But I always started to think, seek first to understand what is it going on with the patient, but also what are my staff saying and how do I support them more and how do I help them? And it is so interesting when that happens. So patients may be one way to you, but maybe one way to the staff member. And for us, the key here is to always support our staff member, make sure the patient always feels that they're right, of course, but somehow in the midst of communication, make sure that our staff members feel supported as well, because they are copping a lot at that front desk. So that is my daily dose of Dr. Fern. If you like what you hear, please share this with all your friends on Facebook, and remember to keep laughing out loud. It is the second best thing that you can do with your mouth.